This is Dr. Martorell, an infectious disease doctor. I am going to be discussing Lyme disease. So Lyme disease is the most common tick-borne illness in the United States. Lyme disease is caused by a bacteria, Borrelia burgdorferi. It is carried by deer ticks. The bacteria is transmitted to the person when a tick bite occurs. In the United States, Lyme disease most commonly occurs in the Northeast, in mid-Atlantic states, and the Midwest. It may also occur on the West Coast. The majority of Lyme disease cases in the United States have been reported in Massachusetts, Connecticut, Rhode Island, New York, New Jersey, Pennsylvania, Delaware, Maryland, Minnesota, and Wisconsin. The bacteria that causes Lyme disease usually occurs in late spring and summer and fall. Sometimes the person does not recall a tick bite, they never saw a tick bite, and they never had a rash. The tick must be firmly attached to the skin for 48 to 72 hours to pass the bacteria, and then it may include a rash on the site of the tick bite and erythema migrans. It may include flu-like symptoms, arthritis, heart symptoms like palpitations, and neurologic symptoms as well. Some people may have no symptoms at all, and the symptoms are caused more by the body's immune system or immune response to the bacteria. Inflammation may continue even after treatment or adequate treatment. Basically, three phases: early localized, early disseminated, and late Lyme disease. About 80 out of 100 people develop erythema migrans rash. About 30 out of 100 people remember a tick bite. The most common sites for the tick bite are in the armpit, groin, back of the knees, or belt line, places that usually people cannot notice or cannot see for themselves, including significant fatigue, that is one of the most common reported symptoms, feeling of being unwell, like a fever, headache, muscle aches, joint pain is very common, swollen lymph nodes. It can be sometimes challenging to diagnose because many other medical conditions may present with similar symptoms. It could include meningitis. It could include a facial palsy. And then the late disease may occur when the inflammation affects the joints. This usually happens when the person has not been treated right away or diagnosed right away. Some of the symptoms may include muscle and joint symptoms, neurologic symptoms like pain, difficulty with memory or thinking, numbness, neuropathy type of symptoms, and skin symptoms as well. Diagnosis. Sometimes the diagnosis is clinical. If the person has the erythema migrans rash, that is enough to diagnose. As a matter of fact, the blood tests will be negative when the erythema migrans rash shows up. The person has no erythema migrans or is not sure whether Lyme is what is causing the symptoms, or the provider is not sure, but those symptoms are suggestive of Lyme disease. The provider may order a Lyme ELISA or antibody test. If it is positive, there are some other medical reasons why the person may have a positive ELISA test and similar proteins that may cause a positive result. So it is important to confirm the diagnosis of Lyme disease with a Western blot or other testing available. Once the Lyme ELISA and the Western blot are positive and they confirm the diagnosis, then the person should be treated for Lyme disease. Antibiotics are the primary treatment for Lyme disease, and the majority of people will recover after antibiotic treatment. Some of the antibiotics recommended for early localized Lyme disease include doxycycline, amoxicillin, cefuroxime daily. Antibiotic gets selected depending on allergy history, tolerability history, and other factors, but usually doxycycline is the first antibiotic that is recommended. There are some situations where intravenous antibiotics, for example, intravenous ceftriaxone, may be recommended. So people can get Lyme disease again. And the other important thing is that within that same tick, there could be other organisms that could cause syndromes or symptoms that are similar to the ones that Lyme disease may cause. So some examples include Babesia, Ehrlichia, Anaplasma, among others. And the provider may need to test for all of them. For example, if the person has a co-infection with Babesia, the addition of different antibiotics is warranted. Some people may benefit from prevention or post-exposure treatment for Lyme disease. It is important for the person who thinks they may have gotten exposed or got exposed because they were hiking or doing outdoor activities to check for ticks for at least 3 days. Well, I hope this information was helpful. Like my social media pages. Thank you.